at Security Health Plan. Very pleased to be with you once again for another one of our Wednesday webinar segments. I am joined, I know any of you that have been on with me over the last, 3-4 months will be shocked that my co-host Jeff Tucker is also here. These presentations are co-sponsored by Security Health Plan and Marshfield Clinic Health System, so we're very happy to be here today. And since we're running a little bit behind, I'm going to breeze through some of this stuff, but there is a Q&A feature. Please use it. We are recording. You'll get the recording after the end. Ashley will get that out to everybody that pre-registered, as well as the slides. So if you can't find it there, they are posted to our website under the COVID-19 page. So if you go to COVID-19, there's an employer tab under that, and you'll find this presentation and all of our past presentation links for your listening and viewing pleasure. So Jeff, anything else you want to add, or should we just hand it off to Scott, or do you want to introduce Scott?
I'll go ahead and introduce Scott. So thanks, Chris. It's our pleasure to introduce Scott Polenz. Scott is the Vice President of Physician and Clinical Professional Relations for the Marshfield Clinic Health System. I think Scott has been with the system more than a decade. He can correct me if I'm wrong. He was formerly the Chief Administrative Officer for Marshfield Medical Center in Eau Claire, so was in charge of the Eau Claire region and helped stand up our hospital in the Eau Claire region, and is now in charge of our clinical professional relations and recruitment, and works with employee engagement and all kinds of responsibilities with the system. So with that, I will hand this over to Scott Polenz.
Yeah, thank you, Jeff. Thanks, Chris. Hi, I'm Scott Polenz. I'm just going to give a little background. I was just thinking, this whole Aaron Rodgers situation has been stressful, but trying to log into a WebEx when you're presenting and it's not working is even more stressful. But welcome, everybody. I am going to, as Jeff had said, I've been with the clinic for actually about 21 years, a variety of different roles. Actually, I'm from the Eau Claire area and spent some time also at Sacred Heart Hospital and also in Neilsville. And now in the last year and a half or so, I transitioned to a new role overseeing physician and, as Jeff had said, APC recruitment, and relations, which also includes not just recruitment, but onboarding. How do we bring our physicians and APCs into our organization and make sure it's a smooth and consistent process? As well as a variety of engagement and retention type of activities, which that part of the role is really evolving now. So what we wanted to do today is really just talk about some of the challenges of recruitment and really healthcare and access in rural areas where, for the most part, as I'll show you in a couple slides, is it really just rural Wisconsin, western, northern, central Wisconsin. So the next slide, Ashley, I'll briefly talk a little bit about Marshfield Clinic and some of our numbers, just to give you an idea of our how we go about our physician and our recruitment and some of our challenges. Talk quite a bit more probably about a rural community and why some of our challenges of recruiting to rural communities, but what really the benefits of it. Impact of primary care in our rural communities, some of the challenges and just importance of access. The next slide just essentially shows you, and obviously you're all from Wisconsin, but here's a map really of where Marshfield Clinic serves. And as I mentioned, central, northern, western Wisconsin. We also recently just transitioned the Beaver Dam Hospital down toward more of the Madison area to expand our footprint across the country. But really 55 different communities, and really Marshfield Clinic has been historically, a lot of the smaller communities said we really want to, our folks don't want to travel, or they don't have transportation, or if it's in the middle of winter, driving all the way from Cornell to Chippewa Falls or Eau Claire is overwhelming. Would Marshfield Clinic consider building or transitioning a clinic and having either a physician, family practice physician, or a nurse practitioner or a physician assistant there? So, and we've met that need in 55 or so different communities. We've had a lot of growth, as well as you're probably aware, we historically have been a ambulatory surgery clinic type of organization with a really good health plan. In the last 6 years, we're one of the fastest growing healthcare organizations across the country, and essentially went from 1.5 hospitals to once our Stevens Point Hospital is open in May of 2022, we'll have 10 hospitals. And at the end of the day, our Our vision is to have all three legs of the stool in healthcare: a health plan, really good physicians and advanced practice clinicians and clinics, and also hospitals, so we can have responsibility for lowering the cost of healthcare, for high quality, and for a great patient experience. Just to give you an idea, the next slide, Ashley, to give you some idea of some of the numbers of what we're talking about. And again, this is just for Marshfield Clinic Health System, and these numbers are on the low end, but this just gives you, I'm going to share some stats, some numbers of what a primary care physician means to a smaller community. But these are essentially just not just family practice physicians, pediatric or internal medicine physicians, and advanced practice clinicians, which really, when we say that, we mean physician assistants, nurse practitioners, CRNAs, and midwives. And really, we have about 106 physicians in our Marshfield Clinic Health System that are dedicated to primary care, and about 84 APCs. So really over these numbers again are a bit low, but over 200 or so physicians and APCs are practice primary care and provide access to all of us and our communities and the patients in those communities in our rural areas. The next slide actually just gives you an idea of our recruitment numbers, and it's been pretty fascinating. Not only are we recruiting to rural areas, which can be a challenge, but also doing it during a pandemic the last year or so, and now with the numbers increasing, kind of going back to some of the COVID areas that we had in our hospitals. But we essentially, from 2019 to 2020, had a 37% increase in the hiring of our physicians to the APCs. And we've actually, I'll talk a little bit about it in a couple slides, but we've actually seen, and usually this comes from the spouse or the family, but where they would essentially say to their spouse, female or, hey, honey, it's time to get out of the big city. It's time to get out of the East Coast or Chicago or the West Coast, and let's go to a rural area. Have you heard of Marshfield Clinic Health System and its uniqueness? And maybe it's time to either join a larger system or go someplace where it'd be easier to raise a family. So that's been part of our success during the pandemic, is that physicians and their families have said it's time to maybe move to a rural area. Next couple slides, and then next slide here is just to give you an idea of what we're doing from an overall system. So we have about 12,500 employees across our whole service area, and this is just the first quarter of the calendar year this year. And this is non-physicians and APCs, but essentially almost 800 positions were filled, 420 through which are newer hires, and we actually have 1,600 openings right now. And this is probably one of our top challenges, and I'm sure all of you in your industries or your spouse's industries or people that you talk to, business people that you talk to, is trying to retain and trying to hire new employees. And the competition is intense, and the competition is also, not working. And it's our reality as well. And it's even more nerve-wracking knowing that the pandemic is hitting, and we're going to have more COVID patients. We had 0 COVID patients a couple of weeks ago, and we have over a couple dozen right now, just in a matter of a week, and probably going to have many more in the near future. And you need to have staff to take care of those folks. So it's a big challenge for us. Next slide just talks about, and what we talk to about to our physicians that we're recruiting in our APCs and also their families is, why would you, if you're in a big city and you're making more money, why would you want to come and practice medicine and raise your family in a rural community? And we always talk about Wisconsin and the wonderful schools that we have, very affordable housing compared to the larger cities, obviously, friendly neighborhoods. You actually know your neighbors and help each other out, lower real estate taxes. Ease of transportation. I know I talked to a lot of our physicians, and they're just like, I can get from, and this is maybe not in Eau Claire, but in Marshfield, I can get from one side of the town to the other side of town in 3 minutes or 2 minutes, or I can walk to work. Lower crime, and just many other reasons. So we have spent quite a bit of time putting videos together, partnering with our local chambers, and really trying to talk about the activities and schooling and housing and different things, and why it is a great place to practice medicine and also raise your family. And we have over 395 physicians in the Marshfield area alone, which is a town, if any of you are from Marshfield, a town of 18 to 20,000 people. Quite a few of those are high-end specialists, where there's only maybe 100 of those type of physicians across the country, and they live in Marshfield, and they love it, and they love the ruralness of it and the safety of it and the affordability of it. So we do try to promote this. I just wanted a couple stats here, a couple slides. Just wanted to talk a little bit about the impact of primary care. I'm speaking mostly of primary care. Next slide, Ashley, is the impact is it's greater than the actual employment and the labor income created from just the clinic, and generates economic income impacts at the local hospital with admissions, outpatient referrals, and the next stat here, a rural primary care physician practicing in community with a local hospital. So we're talking, more of like the critical access type of hospitals like we have in Neelsville or we have in Ladysmith. That it creates, one physician can create 26 jobs and bring in about 1.4 million in income, from the clinic and the hospital. So pretty impactful as to what physicians can do as far as the economic impact to community, let alone access to healthcare and trying to keep people healthier, which we know is a challenge in rural areas. And we're typically the largest or the second largest employer in a majority of our communities. And a critical access hospital usually has, close to 200 plus employees and close to a little bit over $8 million in payroll. Next slide here just talks a little bit more about some stats as far as related more to recruitment. Merritt Hawkins is a recruitment firm that is often used, and they will tell you that 93% of the medical residents say they would prefer to practice in a community of 50,000 or more, compared to 3% looking for communities of 25,000 or more. So in our depending on how you count the numbers in Wausau West, and we really in our service area only have one community that has over 50,000 in the Eau Claire Triple Valley community. So we're recruiting. So we're essentially saying there's 7% of the physicians out there that want to practice in our communities, and how do we get the other 93% to even take a look at us and apply and hear our story and want to live in rural Wisconsin. Medical schools, some do a good job with rural tracks, but a majority of them, 140 of them, do not. And this just, it's kind of an older stat, but 79.3% of primary care physicians per 1,000 people in metro areas and only 55 in non-metro areas. There is a perception, and some of it's real, but why would I live in a rural community there? I don't have the restaurants that I would have in a big city. And that's especially in the Marshfield area is probably one of our top complaints is that there aren't restaurants in the area, or there's not enough, or there's not the type of food that I would like. Shopping, culture, and arts is a big area. Highly ranked schools, job security, meaning in a lot of smaller rural areas, some of the hospitals that haven't been able to survive, and then they get paid more in large communities. Now you couple that with less taxes or a more affordable house, but a lot of times people look at the salary. And then the last slide here is just really just access to healthcare. I could spend hours talking about this, but national data will tell us that our rural Americans are older, sicker, and poorer than their urban counterparts. And just talks a little bit about more of that. And then we have a lot of broadband internet access issues in our rural communities where people don't have access to the internet, so they can't do telemedicine, or they can't afford to get transportation to come to the physician. And those are very real challenges as far as access to care. However, we're very lucky. We have just some excellent healthcare systems in rural Wisconsin, Mayo, obviously, HSHS, Spirus, and we think Marshfield Clinic Health System does a wonderful job as well. And I think we all have part in retaining and recruiting physicians in our rural areas. I'm spending a lot of time trying to put social type of events together. We just did something for our physicians with the pandemic. It had to be social, but we partnered with in Eau Claire a little organization called The Forage, which goes out and tries to find different food folks or art type of people and teach classes. So we did a meditation class and a painting class for a physician, and really trying to integrate our physicians and their families into their communities supporting them, supporting local communities, and that's a good way to retain physicians and recruit them too. So with that, that's all I prepared. I wanted to just talk for 10 or 15 minutes or so, and I think Chris and Jeff, you guys either open it up for questions or ask me questions. Hopefully that was helpful, and fire away.
Yeah, Scott, thank you very much. Very helpful. Good information. That was a really quick run through, but well, let's start with Scott, do you know what the capital of Montana is? No, I'm kidding. We'll ask you a tougher question. So you mentioned that 7% is kind of the universe for those that are more likely to come to an area. Has the pandemic changed any of that, as more and more people are saying, hey, I don't need to work in the big city in other careers, I can work wherever I want?
Yeah.
Are we seeing any changes, or is it still too early to tell?
No, I don't have necessarily stats of that, but I'm not necessarily tracking it or anything. But we have had a lot of comments that it's time to move out of the city. We've also seen our bigger city. We've also seen quite a independent physicians that said, with the pandemic, it's time to join a system. So we've had some success there. I think the fact that we've had an increase in recruitment of 37% from 2019 to 2020 in spite of COVID, I think talks to a little bit of that. But as far as a stat, I don't know, but I know we've had a lot of people that have said it's time to move to a smaller rural community. And we try to get our physicians, similar to probably everybody in the industry, but we really try to get our physicians and their families to help recruit, because they're the best people are going to say, look, I know you can make more money in New York, but you get to practice, you get to walk to work, it's safe, we'll know each other's kids, I'll mow your lawn for you in the summer if you're not, if you're not there, those kind of things. Those are very attractive ways to recruit.
And then Scott, what about telehealth? I'm sorry, Jeff. So Scott, what about telehealth? So I know that we've had different presentations on these sessions related to telehealth. How is that impacting recruiting, or is it at all? The fact that maybe in some smaller communities we can bring more services to a rural area through the use of a telehealth type program.
Yeah, it's a big part. I believe in Ladysmith is our largest, just because of the transportation issues and being a lower income area. We do a lot of our telehealth in the Ladysmith area, so that's been very popular. Broadband and internet access is a challenge. We've also, for the first time in a long time, have actually hired physicians that didn't move here. And this was even a little bit before the pandemic, but during the pandemic, I think we've all realized that maybe this virtual world isn't a terrible thing. We've actually hired a few, two in the behavioral health area, where they didn't actually move here. They're physically practicing and doing telehealth 100%. One of our physicians is a psychiatrist in Chicago, and she's seeing patients full-time for Marshfield Clinic telehealth. So I think that's pretty exciting. I think that's only going to grow.
Thank you. Jeff?
You touched on, I think, my question with that last answer, Scott. You had mentioned that we have something over 1,600 positions open, and I was wondering, has the virtual world helped or hindered? It sounds like the world has changed dramatically under the pandemic, well, which we all know, but I'm just wondering, what does that mean in terms of placements? Are positions being redesigned for a virtual environment?
Yes. In fact, we just talked about that this morning in a different meeting, and I think every industry is trying to figure out, okay, so for the most part, in healthcare, for the most part, everybody's worked on site or in some sort of building, except for maybe dictation. Oftentimes dictation is either contracted out or people can work from home because you can track their stats. And I think there's always been a nervousness. Well, people are just going to hang out and walk the dog, all day if they're working from home. But I know we're figuring out right now as we speak, there are people that can work full-time virtually and have chosen to do that. So, I don't know percentage wise, but I suspect 20-25% of our employees won't come back to a physical building, and they will work from home. And probably more likely there's going to be a combination of, office time for certain meetings that need to be face-to-face post the COVID or post the pandemic, hopefully. And then going to be working from home because I don't have to travel. I have internet. It works fine. So I think it's too early to tell, but I know we Marshfield Clinic is saying to a certain group of people, you don't need to come back. And people, I think a lot of people are embracing that.
I think that's awesome. I think that's going to change the pool and types of candidates that we could potentially recruit by the sounds of it.
Right. Well, I mean, one of the biggest challenges, not only for physicians, but is, we have a research education and a lot of researchers and different people that are very high end, very hard to recruit. If you can offer them a position that is, either 100% virtual or a certain percentage virtual, and they can still live where they're living now, boy, that's a win-win for everybody. So I think there's going to be a lot of opportunities for us to recruit these higher end type of people that don't necessarily want to live in Ladysmith or Marshfield or Armonaqua.
Scott, there's been a lot of discussion around the country about people retiring early and leaving the workforce kind of as a spin-off of the pandemic. Are we seeing any of those impacts on the physician side? Or again, is it just too early to tell?
I'm not collecting any data, but we have seen physicians at the end of their career just kind of go, okay, I was maybe going to do it for another 3 years, but I want to take care of my either one of my parents or my spouse had COVID, or maybe it's just time. So and it's been difficult, as we all know, it's difficult in every industry, but in healthcare to take care of all the COVID patients and the challenge of staffing and PPE and all these different things. It's been stressful on people. So I don't have stats, but I do know that I've seen retirement notices, and some of them are related to, I'm going to hang it up now. This has been a tough year or so.
Is there an opportunity for some of those medical staff to be on a part-time basis so that we can hopefully, head some of that off and allow them to ease into retirement on a much slower pace?
Yes. Yeah. We're actually, so we have, I don't want to get into too much detail, but we do have a different type of arrangement with our physicians as they get closer to retirement, or they just want to step back a little bit. With a different contractual arrangement called a non-Class A member contract. And we've seen more of those probably in the last year than we have in the history of Marshfield Clinic. And I think some of it is that just at the end of the career, I don't want to take call 1 and 3. I still want to practice, but I don't want to have the intensity that I've had for the last 30 years. So yeah, definitely some great opportunities.
All right, I'm not seeing any more questions coming through the chat, but obviously those of you that are on this webinar, spread the word that we are definitely in a recruiting mode to get more medical staff, physicians and so on, and Scott Polenz is willing to mow their lawns, is what I kind of gleaned from this. So spread that word as well.
And shovel snow. Shovel snow. You're right.
Have more, will travel. Scott, it's been a great pleasure to have you on today to talk through this topic with our participants today. Really appreciate you coming on and putting this together. And I know your contact information will be in there as well if people do have questions following up. Jeff, I'll hand it off to you.
I think you closed it well, Chris. Thanks very much, Scott. This was really, really interesting. And it's interesting the health system is adapting post-COVID in a virtual world, and all of the opportunities and challenges that presents. I think this has been fascinating, so thank you.
Yeah. Do you guys need my address for the gift basket you're going to be sending?
No.
Yes, please leave it with Ashley.
We're just waiting for that. When you show up to mow the grass, we'll hand it over.
Okay. All right. See you.
Thank you very much, everybody. Be well.
Bye.
Have a great rest of the day.